The mental health support team in schools works across Devon, and we're in schools to support them in becoming more mentally healthy environments and to make sure that mental health in schools is taken seriously as a physical health condition. So we wouldn't expect someone to come to school with a broken leg and go through them day like normal, and we want mental health difficulties to be treated in the same way. The kind of things we do on the team to help children and young people is we deliver workshops on mental health that's giving information around different topics around mental health, so coping with anxiety, low mood, coping with exam stress. We provide support to staff within schools. We provide staff training and one-to-one support for staff who might be supporting students that are struggling with mental health. And we also provide one-to-one support for students that might be struggling with things like depression and anxiety.
My mum and dad noticed I was anxious at school.
Did anyone at school know how you were feeling? Friends?
I don't think so, to be honest.
Ryan was really struggling at school, so he would come home and be quite upset because the transition between going from primary school to secondary school was being quite difficult for him. He didn't find it very easy to talk to people.
Because school was becoming really difficult, so I thought that I could go and get some help from the MHS.
When he started working with his practitioner, he would come home and say, "Yay, I've seen my practitioner's day," and sort of go through what's been going on. And so it was absolutely amazing. It's been really, really helpful. It's enabled him to talk through some of his worries and challenges and been able to put his thoughts into some sort of order that he can manage. And it's been something that we can actually do alongside as well. So it's not to confuse him. We've been sort of doing the same things with him. So at least he gets that from the school, from us and from the team, so that we've got that sort of continuity of how we're supporting him and how he can actually have better control over his thoughts and his worries and in a more positive way.
We work with the mental health support team through interventions mainly with our young people, so that is providing low intensity CBT through face-to-face interventions that go on weekly. We then also look to provide support for our staff through Time to Reflect, which is a supervision space, but also non-pupil evenings where staff are trained on what is mental health, what is anxiety, and making them feel more confident in their ability to manage those common mental health issues within school. We then also look to collaborate with the mental health support team around providing support for our parents and carers of our young people. So that's again looking in a similar way to staff, upskilling their knowledge and understanding, but also bringing them into interventions, which isn't common practice with other services, which is one of the perks of the mental health support team.
So the main way that we help children and young people is through an approach called cognitive behaviour therapy. So we use low intensity cognitive behaviour therapy, and what this means is quite often it's not our events that we experience in our lives that upsets us, it's our perception of them. So for example, if I'm walking down the corridor and I wave at somebody and they wave back and I think, oh my God, they hate me, that person doesn't like me anymore, I might feel anxious, I might feel really tense, and I might withdraw and not speak to that person anymore. And then that confirms that thought that they don't like me, and we get stuck in these cycles without realising. So we support children and young people to realise if they've been trapped in one of those cycles, and we help them to break out of them through changing what they think and checking out the evidence for their thoughts and for what they do to changing their behaviours. Because if we change one of those things, the cycle breaks and we can do things differently and achieve our goals.
It's made such a difference, and I think that the sooner that you can seek support, get that support and help your child move forward, the more that child will be able to settle down, be able to understand themselves and feel validated and supported in their journey forward to becoming a young adult. It's absolutely crucial that you seek support if you feel that you need help, and I have to say that the mental health support team have been absolutely amazing for my son.
It's okay to not know exactly what's wrong. You might just have a sense that things feel a little bit off. You might be experiencing scary thoughts, and it's quite common to have thoughts about not wanting to be alive anymore, or even thinking about hurting yourself. And if you are having these thoughts, these can be really scary, but it's okay. These are symptoms of poor mental health, and we can offer you support to help with these.